Hey everyone, thank y'all for joining me today. I'm Empress Tori-san, and I just woke up with wanting to talk to y'all about the importance of vitamin D during pregnancy. Most women, especially black indigenous women and black African American women, we are deficient in vitamin D from the get-go, even before we become pregnant. And that is not everyone, but that's a nice portion of women already vitamin D deficient before they get pregnant. And once they are pregnant, they're still not getting adequate amounts of vitamin D, which leads to inadequate amounts of vitamin D postpartum, which leads to increased postpartum depression, increased postpartum anxiety, which then reduces the safetyness of the home environment for the newborn and other children, which causes developmental issues in the children. See, it's just a ripple effect. Vitamin D is important to get during your entire pregnancy, but it's really important during the first trimester when a lot of women don't even know they're pregnant yet, or maybe they found out right a little bit after the middle of it or towards the end of the first trimester in some cases. Even if you are unsure if you got adequate amounts of vitamin D during your first trimester, it's important to move forward trying to get the most you can get. Usually they recommend 1,000 to 2,000 IU international units of vitamin D per day for pregnant women. But in a lot of cases, a lot of studies, dose of, not at once, but a total amount of 4,000 international units of vitamin D a day help reduce the chances of preterm birth by 30% and to reduce the chances of preeclampsia by 45%. Now, if you are getting your vitamin D from whole foods, it's important to make sure you are increasing the fat, at least fat intake when you are consuming your vitamin D. And if you are using supplements, then it's important to take your vitamin D maybe with if your vitamin D has coconut oil or fish oil with it, because it will increase the absorption that you need. Vitamin D is very important as well, because if you do not have an adequate amount of vitamin D during pregnancy, you could end up with a shorter baby. If you do not have an adequate amount of vitamin D during pregnancy, your baby could possibly have a future of teeth disorders, health issues when it comes to diabetes. It could also increase the chances of them having rickets. Vitamin D is very important for our mental health and our physical health, our daily living, and it's important that we do our best to get as much as we need, not only for us, but also for our babies and their future health. Thank y'all for joining me today. Again, my name is Empress Tori-san. I am an integrative women's wellness practitioner, perinatal mood disorder specialist, and the soul and womb weaver. Thank y'all, and join me again.